Ladies and gentlemen, imagine this. You wake up in the morning, and the first thing you feel is not refreshed after a good night's sleep. But the first thing you feel in the morning is pain. As you look around, you see hospital beds on your left and to your right. Well, you are in one too. As the doctor have said earlier, you have been diagnosed with a terminal disease, colorectal cancer, or something like that. There are numerous tubes pierced into your body. Tubes that are pierced into your nose to help you breathe. Tubes that are pierced into your blood vessels so that you don't need any food. And also tubes that are actually pierced into your bladder so that you don't even need to go to the toilet. But then it also means that you can't do anything at all. You can only lie in the bed. Either you sleep or sleep. There is nothing you can do. And every day pass with pain in your body as the cancer attacks your cells. So if you're living that kind of life, dying seems pretty much like your only means of escape. But the question is, would you choose it? Would you prefer to die if your heart stops beating? Or would you choose to fight this cancer and see if your body can take it up or not? Ladies and gentlemen, good morning. My name is Alex and I'm a first year medical student. And today I'll be talking about DNR order, where dying is a form of escape. But first, let's ask a question. What is actually DNR order? DNR order is an acronym for Do Not Resuscitate. So Do Not Resuscitate order is actually a medical order written by a doctor which instructs healthcare providers not to do cardiopulmonary resuscitation on a patient if that patient lost consciousness and does not have any heartbeat. This includes chest compressions, uh, intravenous drugs such as adrenaline to restart the heart, and also intubation, where the doctor may insert a tube into the patient's lungs to help him breathe. So none of that will be carried out for that patient should that patient lose consciousness and his heart stops beating. Now, another question would be, is DNR order legal in Malaysia? As DNR order essentially says that doctors should not help patients even if their life is endangered. So for Malaysia, it is actually in a gray area where doctors and nurses would usually accept and follow a patient's DNR order. But neither the Mental Health Act nor the Medical Act 1971 provide any legal framework regulating this advanced medical directive. It shows to say that if you were to follow this DNR order in Malaysia, nobody can sue you. But if you choose to save that patient as well, you're not doing a wrong thing. It's just that if you choose to follow the DNR order in Malaysia, it may have social implications, since in our minds, doctors are supposed to help the patients at all costs. And doctors have 4 medical ethics that they have to withhold, which is one of them to benefit the patient. And if you choose to follow this DNR order, it essentially says that the doctor will just leave the patient to die. Now, for this presentation today, I'm going to be talking about the reasons DNR order is opted and signed by patient. So there are normally 3 reasons for the patient to sign a DNR order form, which the first one, if the patient feels that effective CPR is unlikely to be successful to him, or if the situation says that effective CPR will definitely fail. The second one is if successful CPR is likely to be followed by a low quality of life for that patient. And lastly, CPR is not in accord with the sustained wishes of the patient. So it's just that the patient does not want to live anymore. First, effective CPR is unlikely to be successful. So there are some cases where CPR is contraindicated, which means that CPR should not be done. So if the probability of saving that patient approaches 0%, CPR is said to be futile, useless, and will be of no benefit to the patient. So in this case, the doctor will not benefit the patient if the doctor administers CPR to that patient. So it means that you're not doing anything good for that patient if you're trying to save his life. It may mean the opposite. If the patient, and also if the patient has any underlying condition which may become life-threatening when CPR is administered. So it makes it even less likely for that patient to survive if CPR is administered. For example, a patient, is a smoker, and has underlying lung diseases, such as emphysema, that causes the lungs to be easily punctured if CPR is administered. So even if the doctor can restart the heartbeat, but the patient may just die because of another cause, a punctured lung. So you're saving the patient from having a heart attack, but you're killing the patient at the same time by puncturing his lungs. So the patient may just die because of collapsed lung. Moving on. In situations where successful CPR is likely to be followed by a low quality of life, the patient can sign a DNR order form. Now, let's be honest, CPR is not perfect, not as the ones you see in movies, where having chest compressions about 10 to 20 times and the patient wakes up miraculously. No, reality is much more harsh than that. CPR can take as long as 5 minutes all the way to 20 minutes. 5 minutes all the way to 20 minutes. So for each passing minute, if that patient does not revive, it means that every minute the brain is deprived of oxygen and is deprived of blood supply. So this kind of CPR may cause irreversible brain damage, especially if CPR takes longer than 20 minutes. So after 20 minutes, even if you can restart the heartbeat and the heart starts beating, you may only be able to save the brainstem, not the life. The patient may be comatose forever, living using a mechanical ventilator and lying in the bed all the time. Now, CPR also has secondary effects, such as rib fracture, damage to internal organs, rupture of trachea or esophagus, if that CPR is administered by an untrained professional. Such injuries to these organs may seem as a small matter for younger generations. But what about the elderly? What about those that are compromised? What about those that cannot recover that fast? Will they be able to live with these injuries for the rest of their lives? So this decision is very controversial, and if you are a patient with this kind of conditions, it is best to think twice. Now, lastly, CPR is not in accord with the sustained wishes of the patient. So as doctors, we have also another medical ethic that we have to follow, which is patient autonomy. We need to follow what the patient wants. So if the patient does not want this resuscitation, does not want to be revived after his heart is stopped, we have to honor the patient's wishes. It may be due to personal reasons, such as unsatisfied with the quality of life now, or relational factors, which is unwilling to burden someone else, or it could be philosophical reasons, which the patient is realistic with the probability of living is and just wants to die. So these are the thoughts of the patients that have signed the DNR order. It causes hardship for my family watching me suffer every day. If I'm going to live on a machine, someone's going to take care of that machine, and I don't think that's fair. I don't want to be kept artificially alive. When the body cannot sustain you, you are dead. Or could be as simple as, if I really only have 3 more months to live, I don't really want to have any more pain. So let's take a look back on the reasons why DNR order is signed by patients. So first, DNR order is signed by patient when situation says that effective CPR is unlikely to be successful, which the probability of saving the patient approaches zero. The doctor can choose not to resuscitate that patient. And secondly, successful CPR is likely followed by a low quality of life for that patient. So it can cause irreversible brain damage or comatose the patient for life. Lastly, it is not in accord with the sustained wishes of the patient. So doctors will have to honor this patient autonomy. Before I end this presentation, I would just like to say that the meaning of life is to be lived. But if you suffer each and every day from your illness, it is not wrong to just give up. Thank you for your attention.